And that's why that, having a medical team and actually using the medications to change your lifestyle and your relationship with food, and use the motivation that you get from those results to help you maintain those results, is the most important part to losing weight in a healthy way and sustaining that weight loss. And that's what we do here. If you get online, you get on Facebook or anything else, there's tons of places you can go get, semaglutide or tirzepatide. I would argue that they aren't the safest places because you don't know where it comes from. A lot of the stuff you see out there are what they term research chemicals. They're research peptides, and they're companies, and it says on the bottle, it's got a little disclaimer on there, not for human use. Where is that stuff made? Who knows?
And what's it made for if it's not for humans?
Well, they put that on there as a disclaimer so that they can sell this stuff to people and basically get around the FDA regulations. So there's really only two legitimate ways to get these medications, in my opinion, and safe ways to get them. And it's number one, it's get the brand medication from the pharmacy, which if you have insurance coverage for it, that's a great option. But about only like 47% of people's health insurance actually covers these drugs for weight loss. So there's a lot of people out there that need it that their insurance doesn't cover. And so if you can't get the brand name medication, the next best option is a reliable compounding pharmacy. So we work with a compounding pharmacy out of Texas. It's one of the largest ones in the nation, and they've been in this business for a long, long time, and they provide a number of products, not just semaglutide and tirzepatide, and they manufacture things in a safe way per all the FDA regulations, and provide semaglutide for patients. And so, the brand name, if you had to pay out of pocket for it, might be anywhere from $700 to $1,100 a month.
I've seen people talk about up to $1,500.
Yeah.
I guess maybe during the shortage, peak times of it, but that's wild compared to what you can pay here.
It's really kind of crazy because if you can get the same medicine made in the United States that they ship to Turkey, like the country, or to Mexico, you could fill that prescription there for $170.
Not to get political at all.
Yeah.
But what Trump did recently, signing that act, that emergency act, or that favored nations deal to bring pharmaceuticals down,
Yeah.
To whatever the lowest. If you go sell them to Turkey, for example, for X amount, you can sell them to us,
Right.
for X amount.
Yeah.
And just as a consumer, and I think I can't fathom anybody having a problem with this. Now I've seen some people say capitalism, blah blah blah, but I think that medicine should be excluded from peak capitalism. It's like you shouldn't be able to just blindly charge people whatever just because they'll pay for it when we're talking about medicine.
Well, they couldn't just do that. The market would work if you didn't have insurance in the middle of it, and that's the trouble, is because
Because sometimes, like the insurance companies, you tell me if I'm wrong here, but I've heard this and I've heard other people discuss it, that the insurance companies, even though they're the ones paying for a lot of these overpriced things, they're actually part of negotiating that price. And they say, well, we'll charge them this, and then we make it up on this other stuff.
Yeah, well, the insurance company's going to make their money.
Yeah.
Do you see an insurance company that's going out of business or losing money? No.
No.
Because it's mandated that you have it, and there's a mandated profit in it for them. And so, it's a really complicated issue. It's
above my pay grade. I try not to speak on it too often because I don't want to be, it's not that I don't want to be wrong.